Now at 9:14, 75 confirmed cases of syphilis in Oklahoma County alone. These cases range in ages from just 14 years old to 47 years old, and officials tell us this is connected to a specific social network. Joining us now to talk about this spike, Tiffany Elmore with the Oklahoma City County Health Department. Thank you so much for being with us.
Thanks for having me.
Wow, we're talking about 75 cases starting as young as 14 years old.
Absolutely.
You are now referring to this as an outbreak.
We are, yes. So we have 75 cases that are confirmed that age anywhere from 14 to 47 years old. And when we say specific social network, the things that we're noticing, these individuals have multiple sex partners, they trade sex for money or drugs, and they also use drugs.
Okay.
So those are risky behaviors that put them at risk for any STD, but in this situation, these individuals have confirmed tested positive for syphilis.
I'm glad you mentioned the social network, because people, when they hear social network, they immediately think social media network.
Right.
And they think, well, are they meeting on Tinder or Craigslist? Does this have anything to do with a social media network, or is it just a social network?
It's just a social network in general.
Okay.
So it's a group of individuals that have those risky behaviors, that maybe hang out together or work together, and with those risky behaviors, they've put themselves at risk for contracting, and some have tested positive.
Okay, so I mean, the movie about Facebook was called The Social Network, so I understand how people got a little bit confused thinking this had to do with social media, but this does not have to do with social media. It just has to do with people who are engaging in these illegal behaviors and
in this
dangerous
lifestyle.
behavior.
Yes.
Quite frankly, people have been doing drugs and engaging in prostitution for quite some time. Why are we just now seeing a spike in syphilis? What has changed?
Well, I think over the past we've always had syphilis cases, but as more people travel, as more people engage in these risky behaviors, then it increases the chance of spreading these diseases. So where we used to maybe see a handful of cases a month, we're now seeing this spike all of a sudden in syphilis.
Dozens and dozens. Is syphilis treatable, or is it one of those that once you have it forever?
Syphilis is treatable.
Okay.
If you go in and get tested, we do have medication that we can treat you with. However, some people don't show any signs or symptoms. So if it goes untreated, there may be irreversible severe consequences that you can't treat. And those could be things like damage to your heart, your eyes, your brain. So those would be things that are irreversible, that are not treatable.
Or if a woman is pregnant, isn't there also damage that could be done to the unborn baby?
Yes. So the woman herself is at risk for complications, but there's also risk of putting the child at complications, or even in worst case scenario, stillbirth.
Wow. And you are offering we have information, some free screenings for this through the City County Health Department. We have the information up there. Are you seeing a lot of people show up for this, concerned about? Okay.
Yes.
Well, that's good that they're at least getting tested.
A lot of people tested. One thing that's helped is we're encouraging any family or friends that maybe know someone or have someone that has one of those risky behaviors that we mentioned, to encourage them to come into us and get tested. We are offering free and confidential testing and treatment. So anybody that maybe falls in that category or knows someone that falls in those categories, encourage them to come see us and get tested.
When you hear 14 years old, you've been doing this for a while.
Yes.
Did that shock you?
It did. It does. It is shocking to see someone so young engaging in these types of behaviors.
I mean, we're talking prostitution, prostitution for drugs, sex for money, drugs, period. Is there a certain drug that is more common with syphilis? Is it something with needles? Is that how they're...
Needles. So any drug that you could use with a needle, that's how they're contracting it. They're sharing it. They're using dirty needles.
Is there a certain part of Oklahoma County where you're seeing this more prevalent? A certain city, or just kind of...
It's just within Oklahoma County. It has been confined and contained with Oklahoma County so far.
Were you, I mean, when I heard syphilis, a syphilis outbreak, when we were reporting this for the first time, I was taken aback by this, because, you know, you have medication, there's protection. I just, what is really causing this? Such a spike, 75 confirmed cases.
Right. I think the first thing is education. So
Okay.
we've got to have these open and honest conversations with our children. We've got to have these open and honest conversations with our family members and loved ones. Providing reliable and accurate education is critical in helping prevent this. Parents, the kids will hear it eventually, so we want them to hear it from a reliable source. So it's important for these people to have conversations with their children. It's important for people to have conversations with your healthcare provider. And if you feel like you are at risk or maybe have contracted something, to go into your healthcare provider and get tested.
At what point do you have a responsibility as the health department, a legal responsibility, a 14 or 15-year-old child coming in saying, I had a sexual partner who is maybe older.
Right.
I mean, that's
Right.
rape technically, but these are confidential screenings.
Right.
Do you turn them in, or what do you do there?
Well, we are obligated to report anyone that we think is being abused,
Okay.
neglected, anything that we think might be human trafficking. So we are required to report those incidents.
And take it very seriously.
Yes.
Let's talk again really quickly, the common risk factors associated with this syphilis outbreak, those dangerous behaviors.
So it's anyone who has sex with multiple partners, anyone who trades sex for money or drugs, or anyone that uses drugs.
Anyone that uses drugs. And do you see it more often in boys or girls?
We're actually seeing a very healthy mix right now of males, females, and all ethnicities. So the thing with any STD is it does not discriminate.
Okay. Tiffany Elmore with the Oklahoma City County Health Department. I wish you were here to talk about something a little bit more enjoyable, but this is really, really important. And again, you are offering free screenings, free confidential screenings, a syphilis outbreak going on right now in Oklahoma County. Thank you so much for your time. We